Morning, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases with our weekly COVID update. So the leaves are falling. We're past peak in colors, I think, but still pretty out there. Last big warm day of Indian summer, I think. Cooler from here on out, which will become important, I think, for the holiday. We'll talk about that. The cases in our area here remain modest. If you take the CDC's categories that they make, it would be still substantial. But these were numbers that were generated before the pandemic and the metrics that go with that. But yeah, we're still seeing cases. We're still seeing people hospitalized. I predicted that would have a little bit of a sweet spot in the first couple weeks of December with a low case number. It looks like we already hit our sweet spot, actually, probably last weekend. Since then, our cases in our region, the Triad region, and also to the west and to the south and to the north, have started to increase again. We hit a nadir of 12 last Friday, and now we're up at 18 per 100,000 per day. Here in Forsyth County, Guilford's about the same. Wilkes County is around 30 per 100,000 per day, and same with Surrey and Stokes in the 20s. So things are starting to go up again. So I think we hit our nadir. Our sweet spot is over, and we'll start seeing our cases go up. Now, will this be like it was last year at this time? No. In fact, if you look at the number of cases on November 18 from last year, and you look at our November 18 this year, we're about a fifth of what we were last year at this time. And the very sharp exponential increase that we saw last year is not happening this year. It's more of a kind of a creep up rather than that. And I don't think we're going to be like what we were for our Delta wave. I think that's over. But they'll go up for respiratory viral season, and they'll be mixed in with flu, and they'll be mixed in with other respiratory viruses. So it's going to be kind of a tough respiratory viral season, particularly for the healthcare sector. And it started early this year. Over 100 cases now of influenza have been recorded in the last 2 weeks at Wake Forest University, and that's very similar. A lot of other universities in the Midwest and up and down the East Coast are seeing outbreaks of influenza on their campuses. In fact, COVID, though, at Wake Forest remains a very rare event, actually. In fact, the influenza to COVID ratio is about 50 to 1. So it's going to be a tough flu season, and COVID will still be around. And so that's gonna be tough for our acute care hospitals, because flu season and respiratory viral season produces pneumonia, even if it's not COVID, and they get admitted to the hospital. So that happens every year, and this year it's going to be a little worse than the usual year, because the resurgence of flu and COVID. We'll have to see how it really shakes out, but I'm not so sure the H3N2 virus and influenza that's circulating is a perfect match on the vaccine. It may make things even a little bit worse. When will the mask mandates go away? Well, I don't think we're going to hit the metrics that were set out here in Winston-Salem or in Guilford County, which we were talking about around 10 cases per day per 100,000 people, and a percent positivity less than 5% that was sustained. Our percent positivities are slowly creeping up too, so I don't think we're going to hit the metrics. So we'll have to see what our city and county leaders want to do with that. My mass work, mass reduced transmission, mass will help us get through the winter respiratory viral season. People, in order for them to work, people will have to wear them, and they'll have to wear them correctly. There's probably quite a bit of mass fatigue going on, and that's not helping our numbers right now. Our pediatric vaccinations, we have we're knocking on 600 in the Wake Forest network. The county has been immunizing kids. There's been a few immunization clinics for some of our schools, and then some private organizations immunizing, as well as some private pediatricians' offices. I just saw this morning across the country, 2.6 million kids between 5 to 12 have now been immunized. We got a long ways to go yet, and the more kids we get immunized, the faster we'll get out of this, and the better of a respiratory viral season we'll have. And the vaccine works in the kids, and the vaccine is safe in the kids. I know there are a lot of parents holding out to see how their neighbors' kids are going to do first, but I don't think that's necessary. And I'd go ahead and get your children immunized now so they can be fully immunized for the holiday season, which will make a really safer holiday for extended families, particularly if you have elderly people or people with underlying health conditions or immunocompromised in your families. During the holidays, if you do have people with underlying health conditions and who are immunocompromised, even if everyone's vaccinated, you might want to consider doing a home test before getting together, because they're vulnerable hosts. And even if immunized, transmission of COVID happens more easily in that group of people. You could also consider wearing a mask when indoors and when not eating. Otherwise, I think if everyone's vaccinated in the family this year for holiday season, say, I would have a worry-free holiday, unless you have particular family members who are at the extreme ages or have underlying health conditions. I think you can get together inside and enjoy the holidays together if you're vaccinated. And that includes kids. Now, the kids under the age of 5 have not had the opportunity to get vaccinated yet. That probably won't be a possibility until late winter, spring time frame. So if you do have younger kids under the age of 5 in your family, then you might want to modify how you get together a bit for the holidays. But there are ways to do it, and with using masks or spending a little bit of time outside when the sun is out and warm, and having the kids out then, and kids under the age of 5 will wear masks, so they can do it. And then if you surround those kids with vaccinated people, then it's a cocoon of safety around them. And that increases the safety of getting together. We're still on track for oral COVID therapy to be out sometime around Christmas, probably. First will be molnupiravir, which is Merck's drug, and then that'll be followed by Pfizer's drug, Paxlovid. They work a little bit differently, but they will both work pretty well, particularly for people at high risk for COVID if they get treated early. And getting treated early is the important thing. Which brings me to testing. The only way to get treated early is to get tested early when you have symptoms. Testing's still hard to come by, for a lot of reasons, but it's still hard to come by. And I know it's frustrating for people, particularly for people who are in historically, ethnically, and racially marginalized areas. It's hard to find a test. If you're symptomatic, getting tested is really important. If you're asymptomatic and you want to do a certain activity, either that requires a test, like going on international travel or going to a concert, potentially going to a basketball game, then finding a place to get an asymptomatic test is a little bit harder, and you're going to need to plan in advance. I think as time goes on, that will get easier and better, but right now you have to think about it a bit before you can do it. There's not as many places doing asymptomatic testing. We need to do a better job in our healthcare sector at finding testing and making it available. And it'll become so important for symptomatic people to get tested as we go through the respiratory viral season, because isolation and treatment for COVID is different than isolation and treatment for flu, and that is different from any of the other viruses. The only way to have it done correctly is to know. So, what's going on in Europe? So, a lot of people want to know. Europe's always been a little bit funny. First of all, a lot of Europe has a lot less tolerance for COVID than we have in the United States. So if you look, for instance, at Germany, and I was looking specifically at their numbers this morning by state, Germany's very concerned about the amount of COVID transmission and cases in that country. As of this morning, they're having roughly around 200 deaths in the country per day, which is seems pretty small in comparison to what we tolerate here in the United States. But and then if you look at the individual state rates and numbers, it runs somewhere between 50 to 12 per 100,000 per day. Some of those states are actually less than what we are here in Forsyth County right now. Looks like they're gonna start with their restrictions again with masking and closing public venues. You won't be able to get into a restaurant without proof of vaccination. In fact, you won't be able to do much without proof of vaccination throughout much of Europe. So they take their COVID fairly seriously. So why is this happening? Well, ultimately, if your region, your risk of your region being hit by a wave or a surge of COVID cases really comes down to your vaccination rate and the amount of transmission going on in the community and the other measures that you're doing. So Europe, for 3-4 months ago, when case numbers were very low, dropped the restrictions, dropped the masks, and then went forward. Their vaccination rate in Germany is 68 per 100,000 people, or 68%. We're a little bit lower than that here, but not much. So they're about like what we are. So what's happened in Europe is that every time they get a wave coming up, they've put in restrictions and lockdowns and have done it fairly effectively, and that pushes down the curve. Remember the old flattening the curve we talked about early in the pandemic. When you flatten the curve, what happens is that when you release all of your lockdowns and restrictions, the curve comes back, the wave comes back. It springs back. So it's kind of like flattening of spring, and then when you release your restrictions, it springs back up. So what we're seeing right now in Germany with their colder weather is that there are waves coming back. Here in the United States, and particularly in the South, where we really got hammered by the Delta wave in August and September, we had a lot of people who got vaccinated the hard way, so to speak, and got COVID. And so the level of population immunity is higher because of that. But it also means we had a lot more deaths than what Europe would have with a comparable wave. The bottom line is that any geographic region is eventually going to have their wave of Delta, and That's what's happening in the United States right now, in the upper Midwest and the West and parts of upper New England, particularly the western side of the New England states. Their vaccination rates are still kind of low, comparatively. Not high enough to provide herd immunity yet, and they're having their wave now. They didn't have their wave in September, they're having it now. So if you look at the curves, they can expect what we had in August and September. And so that's a little bit of an explanation. Each time a wave goes through a population, the peak of it gets lower and the number of people get lower, and eventually it extinguishes itself out. So that's why I'm kind of confident that this winter we're not going to see what we had last winter and what we saw in September. But we will have COVID again. More people will get infected, more people will die, and more people will get immune or die. And we could prevent that by getting everyone immunized, and we've said that over and over. I think it's pretty clear that people who've declared themselves as never getting immunized, well, they'll just get COVID. Because before this is over, everyone's going to get it immune one way or another. And it's either going to be vaccination or getting the infection. I don't think anyone will escape it. So that's kind of my remarks. I had a question come up. Is there any correlation between gout and the severity of COVID symptoms? So gout would be considered a comorbidity, which means that for COVID you could have a bit more severe. It's not nearly as big of a risk though as obesity and diabetes or heart disease and lung disease and kidney disease, which kind of top the list. But a lot of people who have gout have other health problems also. So I think it's going to depend more on those other health problems than on the gout per se. But getting COVID is likely to precipitate an attack of gout, and we've seen that, and that's not fun. So anyway, any questions from the group here? All right, Thanksgiving next week. Enjoy. Don't hoard between now and then. I was in the grocery store the other day and I saw somebody with like 10 cans of cranberry sauce, and I thought, my gosh, I can only get through half a can on a Thanksgiving meal. I don't know how you could go through 10. But have a great Thanksgiving, and we'll see you back the week afterwards.